grab?
He's got it. Are you going to send this to all of us?
Sure.
Please?
I'll try.
Me too?
I will.
Okay. Then we'll use this gun.
I think that might be easier. I'm going to caveat this by saying don't stand over your patient like I'm about to do.
All right.
But I'm not getting down on the ground.
Jessica's dispatched to the unknown call.
All right, so I'm going to get into my medic unit. I'm going to make sure we are wearing our seatbelts. I'm going to make sure that my partner has the directions to my call. And I'm going to make sure that they are driving safely and to the laws so we can arrive there safely. From here, I'm going to look at my CAD notes. Does my CAD notes say anything else?
Unknown 26-year-old male.
Okay, so we're going to continue to the call. Once I get to the call, we're going to stay in our medic unit and perform a windshield survey. I'm going to look for any sort of scene safety concerns. I'm going to look for any electrical hazards, down wires, any irate people, large crowds, any animals, I'm going to look at the structure I'm entering into. Are there stairs? What's the condition of the home? Do I see any scene safety concerns from my windshield?
You do not. Single family residence.
Okay, so we're going to get out. We have our PPE and BSI on. We're going to grab the appropriate bags for the call, walk up to the door. We're going to knock on the door, standing off to the side. Does the patient let me in?
The patient's family member let you in.
Okay, so I walk in. From here, I'm still assessing my scene safety, making sure that there is nothing in the house that's going to cause harm to my partner or myself. I'm also going to make sure that we have a clear exit route. Coming in, I'm looking at my patient. I'm gathering a general impression of my patient. So do they track me when I walk into the room?
They do track.
Okay, so I'm looking at the overall skin condition of my patient. I am also assessing that they track me when I walk into the room. My general impression is I have an approximately 26-year-old male lying supine on his couch. What is my skin color?
Warm and dry.
Warm and dry. Appears to be in no distress at this time. I'm going to walk up to my patient. Hi, sir. My name is Jessica with the Anne Arundel County Fire Department. What seems to be going on today?
Oh, I seem to be having some pain in the abdominal area.
Okay. So my patient is tracking me when I walk into the room. They are able to speak. They're speaking in full sentences with no difficulties at this time at an appropriate rate, quality, and fluency and volume. I'm looking at the overall hygiene of my patient, making sure that they are taking care of themselves. I don't see neglect or any failure to thrive at this time. My patient is talking to me, therefore their airway is open, patent, and maintainable. I'm going to check for any odors coming off of my patient. Do I have any odors coming off of my patient? And what is my patient's hygiene?
You do not see any odors and they appear to be well dressed.
Okay. So I'm going to come up and they talk to me, therefore my airway is open, patent, maintainable. I'm going to check breathing, rate, rhythm, and quality.
Breathing about 20 times a minute seems to be regular. Rate and quality, so regular 20 times, equal test drives.
Okay, I'm going to come down and check my pulse. I'm looking for rate, rhythm, and quality of my pulse. At the same time, I'm assessing skin color, temperature, and condition.
Normal, regular, about 90. Skin color, temperature, condition, warm and dry. Color seems to be pink in color. Condition, not hot.
Okay, I'm also going to look at my patient's fingernails at this point in time and do a capillary refill. From here, I'm going to obtain a sample history and OPQRST of my patient, along with having my partner obtain vital signs at this time. I would like blood pressure, heart rate, pulse ox. We're going to start there, and blood sugar. We're going to come in and do our full secondary assessment head to toe. So we're going to start at the head. I'm looking at the patient's scalp and facial structures along with the hair, making sure I see no abnormalities there. I'm going to come around to the external part of the ear and looking into the ear canal, making sure there's no fluid or deformities. I'm also going to make sure that my patient can hear me on both sides. From there, I'm going to come up to the eyes. I'm going to look at the color of the whites of the eyes. I'm also going to see if my patient can track my finger, along with making sure my eyes are pearl. And ask my patient, have you had any vision changes or problems with your vision recently?
I have not.
I'm going to check the nose, making sure I see no deformities. I'm going to make sure air is moving in and out and I have no nasal flaring. I'm going to ask my patient to say ah. At this time, make sure there's no teeth or anything in the airway. I'm also looking at the mucosal membranes, making sure that they are moist and pink. And I don't see anything else. My patient opens their mouth freely and the jaw has no tension on it. Do I see any abnormalities?
You do not.
Okay, we're going to come down to the neck now. I'm going to look for JVD, tracheal deviation. I look for a stoma and any medical alert tags. Do I see any findings?
You You do not.
Okay, I'm going to come down, I'm going to expose my patient's chest appropriately while keeping them respectfully covered. I'm going to inspect first, so I'm looking at skin, size, symmetry, shape, scarring, and open and closed wounds. Do I have any abnormalities?
You do not.
Okay, next we're going to auscultate. We're going to auscultate tracheal, bronchial, bronchiovesicular, and vesicular. I'm also going to auscultate S1, S2, and my apical sounds at this time. From here, we are going to percuss. And then we are going to palpate, making sure I have chest wall stability and equal chest rise and fall. Do I have any abnormalities in the chest?
No abnormalities. Equal chest
Okay.
rise and fall.
Can you point to me where your abdomen hurts?
He points to his right side.
Right lower. All right, so I'm going to assess that last. Here we're going to inspect first, so we're going to look for size, symmetry, shape, scarring, open and closed wounds. We're also going to auscultate our sounds. And then we are going to gently percuss, furthest away first, and gently on the lower abdomen. And then again, we are going to palpate, looking for guarding tenderness, rigidity, rebound tenderness, any pulsating masses in the abdomen. Starting the furthest away, I'm going to press down, press down, press down, and press down that lower right. Do I have any abnormalities?
A little tender in the lower right.
Little tender on the lower right. My patient is conscious, alert, and oriented to me, and I have no reason to believe that their pelvis is unstable at this time. I'm going to ask my patient, have you had any problems urinating? Has your urine been the normal color and smell?
Yes.
Any bowel movement problems?
No.
Any blood in your urine or feces recently?
No.
Any discharge, lesions, or sores in your genital region or buttocks?
Nope.
All right, so we're gonna move down. We're gonna assess the legs. We're looking at size, symmetry, shape, scarring, open and closed wounds of the legs. We're also gonna have our patient bend their knees up, making sure we have good range of motion, and making sure. Can you press down on my hands?
Yes.
Making sure we have equal strength and range of motion in both lower extremities. I'm going to check my pedal pulses. Can you wiggle your toes for me? What toe am I touching? What toe am I touching? I can also come up and check my popliteal pulses at this time. I'm looking for any color changes in the lower extremities along with any pedal edema. I have good circulation to my lower extremities.
Yes.
Therefore, I have no reason to check my femoral pulses at this time since I have good circulation and perfusion down to my feet. I'm going to come up to my arms. We're going to inspect them first. I'm looking at the skin color, looking at size, symmetry, shape, scarring, open and closed wounds. I'm going to check my radial pulses. Can you wiggle your fingers? I'm going to reassess my nails, reassess capillary refill in them. Can you tell me what finger I'm touching? Can you tell me what finger I'm touching? From here, do I have good CMS in both extremities?
You do.
Since I have good circulation in both extremities, it is safe for me to assume that I have no discrepancies in the brachial pulses. From here, I'm going to have my patient sit up. We're going to look at the back. We're going to inspect first. I'm looking at size, symmetry, shape, scarring, open and closed wounds. We're also going to auscultate upper and lower lungs. We're going to palpate, and we can also percuss on the back if we would like. From here, we're going to appropriately treat our patient. We're also going to get into the medic unit. I'm going to get capnography, 12-lead IV. We're going to monitor them and transport them to the closest appropriate facility.
Yes.